everyone, welcome to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. Thank you so much for joining me. For those of you who are new, I am a board certified internist and rheumatologist based out of Dallas, Texas. And here at the Connected Rheumatology YouTube channel, we talk about all things rheumatology, immunology, diet and movement, mental health, and wellness, because we believe it is all connected. Today I'm going to be talking about fibromyalgia, and more specifically, the treatment options for fibromyalgia. Now, I won't really be getting into the alternative or complementary or non-traditional treatments. That is a huge topic and definitely something for another video. But what I want to talk about today are some of the more traditional medications or therapies that your doctor will most likely bring up to you once you are talking about a diagnosis of fibromyalgia. My goal here is to let you know what's out there, what it can do for you, what it can't do for you, and give you as much information as possible so that when you go to talk about it with your doctor, you can have your questions ready. So let's get into it. Before we get into the treatments for fibromyalgia, we need to briefly go over what we know about it so far. Now, there is a lot of research and a lot of theories out there as to what is happening inside our bodies when we develop fibromyalgia and what may cause it. And again, that's a huge topic. I'm not really going to get into every theory out there. Let me know in the comments if you'd like me to dive more into that in another video. But what I want to go over is what the science is pointing to at the moment and how it relates to the way that we treat it. So first, what is fibromyalgia? Well, fibromyalgia is defined as a chronic condition of widespread pain and tenderness. The way it is diagnosed is very nonspecific, meaning that there's no blood test, there's no x-ray or CT scan that can definitively tell us if someone has fibromyalgia. So that means that the way we diagnose this is completely based on you, the patient, on what you're feeling and how you express that, and then what the doctors see on their physical exam. Now, you may have heard of the fibromyalgia tender points. These are various points throughout the body that when pressed with a certain amount of pressure, they elicit pain if you have fibromyalgia. Now, it used to be that you needed to have 11 or more of these points be positive or be tender for you to be considered to have fibromyalgia. Now, we don't really use that criteria anymore to make a diagnosis. We found that it was very inconsistent and not reliable because the doctors just weren't doing it correctly. They were either putting too much pressure or not enough pressure. And so we don't really rely on that to make a diagnosis, although you will see and you will have doctors perform that test. When fibromyalgia was first characterized, it was seen as a condition of chronic pain in the muscles, the joints, and the tendons. But we know so much more than that now. We really see it as a systemic syndrome. Yes, pain is a hallmark of the condition, but you can also get mental fog, extreme fatigue, and a whole slew of other symptoms that have nothing to do with the joint. Now, why someone might develop fibromyalgia is still a mystery, but there are some things that we know. Number one, sleep deprivation is a key component. Lack of quality sleep has over and over again been shown to be associated with the development of fibromyalgia. In fact, one of the first signs that someone might develop fibromyalgia is a flip-flopping of the normal sleep-wake cycle. The second component is still being worked out, and that is inflammation. Now, in the world of rheumatology, rheumatologists tend to think of fibromyalgia as a non-inflammatory condition, and that is compared to conditions such as rheumatoid arthritis and lupus. Now, the truth is that not all fibromyalgia patients are the same, and there have been cases, in fact, a lot of cases of patients who have measurable signs of inflammation, but it's not reliable. So I think instead of saying it's non-inflammatory, a better way to frame it would be that it doesn't have measurable inflammation. Actually, that's not true either in all cases. In some cases, we actually do measure the inflammation. So I think I'm just like thinking another way of framing it would be to say that it doesn't reliably have measurable markers of inflammation that we use with some of our other conditions. So you can see that it's complicated, and you can see why most rheumatologists just default to the easier non-inflammatory characterization. More and more research is showing that the key problem seems to lie within our nervous system. Now, our nervous system is composed of all the nerves throughout our body, our spinal cord, and our brain. It's a very complex system, and one of its main jobs is to tell us information about our environment. It is because of my nervous system that I can feel the chair under me, or I can see the camera. My nervous system tells me when a pot is too hot, and it sends that signal to the brain and tells me it's hot, it hurts, move your hand. And it's that pathway that seems to not be working correctly in fibromyalgia patients. The threshold for pain has been altered. A stimulus that's painful for a fibromyalgia patient might not register as pain, or most likely doesn't register as pain for someone who doesn't have fibromyalgia. Now, what causes these things? That's still a mystery. Does the poor sleep lead to the nervous system dysregulation? Or is it the other way around? And is the inflammation that we see because of the central nervous system dysregulation, or is it a sign of something bigger going on that is also causing the nervous system dysregulation? And then, of course, what about the idea of infections? You know, with COVID and what we're seeing now with these people who have persistent symptoms, or these long haulers, their symptoms are very similar to fibromyalgia and chronic fatigue syndrome. I think it is perfectly reasonable to go back and think, well, all these patients that we've characterized as having fibromyalgia and chronic fatigue, did they also have an infection that perhaps we just didn't recognize at the time? These are questions that I do not have answers for, but you can see how complicated it is. I bring this up only to highlight the context in which the doctors are thinking about fibromyalgia and how it informs the treatments that they're going to give you. The treatments that are out there are specifically focused on the central nervous system, sleep, and not really inflammation. Okay, so when it comes to FDA-approved medications for fibromyalgia, we've got 3. Now, that doesn't mean that you might not be discussing other off-label medications for fibromyalgia, and that's done all the time. It's perfectly reasonable. But when you're talking about true blue FDA-approved medications, we've got 3, and that's duloxetine, pregabalin, and milnacipran. Milnacipran. These are all medications that work in the nervous system in different ways. Duloxetine and milnacipran are SNRIs, serotonin and norepinephrine reuptake inhibitors. Basically, I know it's a lot of words, basically they are very similar, although not exact. They're very similar in structure and chemical structure to the classic antidepressants that we think about. So like Prozac, Zoloft, Lexapro, it's very similar. Now, how they're able to do their work and how they benefit fibromyalgia patients is still a bit of a mystery. There are some who believe that by treating any underlying depression that we know fibromyalgia patients often have, that will then lead to treating the fibromyalgia. Now, I tend to think it's probably more complicated than that. I think that these medications probably have actions on different pathways within the central nervous system. Treating depression is one aspect of that, but I don't think that's the entire picture, and time will tell. The third medicine, pregabalin, is also a medicine that works on the nervous system, and it works on the way the nerves talk to each other. It is a relative of a much older medicine that we've been using for years called gabapentin. And both of these medicines help decrease what we call nerve pain. Now, gabapentin is not approved for fibromyalgia, but that doesn't mean that it hasn't been shown to be effective and that your doctor might talk to you about that one as well. So that's it. Those are the 3 medications. Anytime you're talking about medications that affect the nervous system, side effects like dizziness, headache, and mood swings can be part of the picture. Now, you can go to Google and look up these medications and find a very long list of scary sounding side effects. That doesn't mean they're common or likely. And then there's the big question, do these medications even work? Well, yes, they do, but they're not miracle drugs. These medications can help take the edge off, but this is really where having an experienced doctor who knows how to work with these medications and has experience with fibromyalgia really comes in handy. Every patient's different. Some patients will do well on one medicine, some patients will need a combination. Some patients will need a low dose and won't be able to tolerate a high dose. Some patients will need a combination of high doses of the medications. And it can be a little bit of a trial and error and frustrating. And you know, the truth is these medications can definitely help, but do they typically make someone 100% pain-free? No, not usually. Fibromyalgia is characterized by ups and downs in pain and fatigue. You have good days and you have bad days. And the goal with our medications is to eliminate those bad days as best as we can, to make them as few and far between as possible. But is it going to make you completely pain-free? Probably not. But this is where the non-medicinal treatments really can shine. Now, some may see these as non-traditional or complementary or alternative, but more and more traditional doctors are turning to these, especially as the data is coming out showing how much benefit they can be to patients. So the first thing is sleep. We talked about how sleep is a huge component in developing fibromyalgia, and evaluating your sleep is key to getting you better. Now, that may include a sleep study to look for things like sleep apnea, but it most definitely should include a full evaluation of sleep hygiene and to get you having regular, high-quality sleep without the use of prescription sleep aids. Second thing is physical therapy, movement therapy, exercise, whatever you want to call it, moving. Studies have shown over and over again that doing some sort of exercise, low impact, physical therapy, anything can benefit pain, improve quality of life, and improve fatigue. Now, this can be difficult when you are in pain and in so much fatigue you don't even know how you're going to make it to the bathroom that day. Doing any kind of exercise can seem daunting, and maybe it's just simply that word exercise. That's why I kind of invite us to use different words. Just moving your body in whatever gentle way that might mean for you. But moving our body is absolutely necessary in recalibrating that nervous system that has gone off. And finally, cognitive behavioral therapy. Now, this is done with the help of a psychiatrist or a psychologist, and it's, again, similar to focusing on sleep and movement, has been shown in multiple studies to be beneficial for those with fibromyalgia, albeit it's not usually something that helps right away. Unfortunately, with the stigma that we still have regarding mental health and getting help with that, it can sometimes be daunting for patients to consider this option. So that's it. Those are the basics on what you can expect to talk with your doctor about when you are given a diagnosis of fibromyalgia. It's a huge topic. We didn't even touch on things like naltrexone, CBD, or supplements. And I didn't even talk about diet, which is a huge topic in and of itself. You know, diet is really a key component to how practitioners who do integrative, functional, or naturopathic medicine focus on. And it's, I think, an integral part. The dysbiosis and the alterations in our microbiome, I think we're going to learn, are key in the development of fibromyalgia. Now, can I prove that yet? Nope. And that's why our medications don't really focus on that. But I think if you want a well-rounded approach to your fibromyalgia therapy, you absolutely need to discuss your diet. And we'll be talking about that in upcoming videos. I really wanted to focus on this video talking about the things you most likely will talk about with your doctor, and unfortunately, you probably won't discuss diet. Now, if you have found a gem of a doctor who really wants to get in it with you about your diet, keep that person. But I've been practicing rheumatology for 10 years and taking care of fibromyalgia patients for 12 to 15. And unfortunately, I know the practice habits of most of the physicians out there, not for lack of caring, but for lack of time. I hope you found something useful in this video, a little information and some inspiration for you to take on with you as you go on your Googling journey to get more information. I hope that you're making a list of questions you can then ask your own doctor. Let me know if you have any questions I can answer for you down in the comments below. If you like this video and want to see more stuff like this, please subscribe. Make sure you give this video a thumbs up. Come and check us out on Instagram, Facebook, and at www.connectedrheumatology.com. Sign up for our newsletter. In all of those places, we talk about all things rheumatology, immunology, diet and movement, mental health, and wellness, because it's all connected. Thanks and have a great day.